Canada confirms its fourth case of coronavirus this week. Over 14,000 have now been infected, the vast majority in China. But there's another risk the Canadian government is worried about. That's Prime Minister Trudeau at a Lunar New Year celebration in Toronto Saturday. He's doing the same thing Jean Chrétien did back in 2003 during SARS, trying to quell rising fears and prejudice facing the Chinese-Canadian community.
Cheers. So the people can see we can have a lot of fun in a Chinese restaurant.
But a big difference, social media wasn't around during SARS, and there are now worries that viral misinformation about the virus is feeding the fear. This week, "I am not a virus" started trending in France after headlines like this. Alert jaune, or in English, yellow alert. Yeah, that actually made the front page of a regional newspaper. But it's not just France that's worried. We're going to show you a quick example of how a post can go viral, starting in one country and then spreading around the world, just like a virus. Take this post. It started in Australia. It tells people not to eat certain contaminated foods, everything from Chinese noodles to fortune cookies to iced tea. The claims are false, and it looks false. It refers to the virus as the Corna's disease and supposedly comes from the Bureau of Diseaseology, a completely fake health authority. Australia's real health authority publicly debunked it and warned people to be more vigilant about what they read.
There are a lot of myths coming to bear in some of those social media platforms, and we would really urge people to go to trusted sources of truth.
Still, it's been reposted over and over, even in Canada. Here's another fake message making the rounds in Toronto, warning a coronavirus patient visited a popular Chinese grocery store and a nearby mall, telling people not to go there. Those claims were debunked by journalists, but they're still spreading on Facebook and WhatsApp. Racism is going viral now, but it's not like we didn't see it during the SARS epidemic. And it wasn't just comments. People lost their jobs. Family businesses went under. Some were evicted. And the worry is it's happening all over again. Joining me from Ottawa is Federal Health Minister Patty Hajdu. So, Minister, we're hearing from members of the Chinese-Canadian community that the fears are leading to some prejudice here. Are you concerned about racism?
It absolutely concerns me, Wendy, because in fact the risk remains low for Canadians, and we've done a fabulous job collaboratively with the provinces and territories and at the local level to contain the disease, to ensure that we're doing the appropriate tracking. And again, it's a very low risk to Canadians. So when I hear that Chinese Canadians are being targeted based on either their sort of ethnicity or any other reason, it reminds me of the time that the Chinese Canadian community had during the SARS epidemic, and it's quite concerning.
How much of a problem is other media, other than social media? You showed some frustration earlier this week in a news conference with sort of basically accusing the media of jumping to conclusions. Do you think that the media has been irresponsible?
I think there are outlets that are less responsible, and I think there are headlines that are less responsible. And I think that when we present to Canadians a risk that's far, greater in the form of reporting, then what we're doing is actually, scaring people unnecessarily while preventing them from getting the information that they actually need.
What is it that you've seen that's upset you?
Well, I think when we're reporting, headlines around, a deadly disease that's sweeping the globe, I think we have to be careful about how we're reporting things that don't create an extra layer of fear for people. I think for me, it's very important that Canadians have accurate information about the level of risk, what they can do to protect themselves, and really what the health system is doing, phenomenal things actually to protect them in their own communities. We have a very sophisticated system of public health. It's been noted at the World Health Organization for its sophistication. We've been working so collaboratively that we've been able to really identify people who may have the virus in Canada and contain the spread.
Social media wasn't around during the SARS outbreak. How different has that made it?
Well, I think social media, and we've noted this through a number of other different situations, has the propensity to amplify information that's not correct or that may be alarmist. And I think some people use social media as a way to do that. And I think it's human nature to be afraid of disease and illness. I mean, obviously, people always want to have the best possible health, and they always want to protect themselves and their families. But I think we also have to balance that with what the real risks are to Canadian health. And, you know, we're not taking this lightly. Obviously, we have a domestic responsibility and an international responsibility to be working to contain the spread of this illness. But we also know that there are many other illnesses that exist in this country and other countries that pose a greater risk to health. And so we have to keep things in perspective and balanced and continue to work hard to fight that misinformation together.
Minister Hajdu, thank you so much for talking to me.
Thank you very much.
That was Federal Health Minister Patty Hajdu in Ottawa. Joining me here in studio now is Toronto City Councillor Kristen Wong-Tam and Toronto Star digital producer Evelyn Kwong. So Evelyn, going to start with you. You wrote this piece for the Toronto Star. Lots of comments came after, and you tweeted, "Fellow Asians, brace yourselves for racist fear-mongering garbage. Fly by, and yes, people have asked me if I eat bats." Really? Like, what are you thinking seeing all of this?
Well, seeing this, it's not so surprising just because it's been part of the Chinese and Asian community for so long. You know, going to dirty Chinese restaurants, it's always been kind of a thing that we call, you know, yellow peril, just to be scared of this. Kind of treats like that community as, you know, the things they eat are lesser or more disgusting. So on, you know, Twitter, people asking like, oh, why do you guys eat bats? Why does everyone eat bats? Why do Asian people do that? And that's just not obviously factual in any kind of way. The Asian diaspora is really big and we're really different. We all have different things. And even having to justify that and, you know, say like, we are not part of the coronavirus thing is like, it's something that's, to me, really disheartening. And
yet, Kristen, it's going on, right? Like we're hearing the Stars reported that there's a school that has a lot of Chinese Canadian students. They're saying that the teachers aren't going. There's a dentist who's got a sign up saying, don't come if you've been to China. You retweeted something about a kid who got cornered at school. Like, what are you seeing, and you're a mom. Like, what upsets you here?
Canada is not immune to racism. We do have a history of anti-Chinese racism, in particular in Canada. Anything to do with the head tax or the Chinese Exclusion Act, for over 60 years, there was a specific body of legislation that stopped Chinese Canadians from coming to the country, and then there was legislation that tried to prohibit and discourage Chinese migration. So this is not necessarily new. The challenge for us today is that people are panicked, and in the absence of good, solid information from credible medical outposts, people are starting to resort to their own fears. So they're looking for someone to blame, and they're looking to scapegoat. And unfortunately, if parents are not seeking out good information, providing that to their children, and teachers are not having this like credible conversation at the schools, there is going to be fear and panic. And that's what we're seeing. But it is definitely xenophobic, and it's definitely racist.
Evelyn, another thing we've seen, we saw a public health official talking about Chinese Canadians wearing masks, and that, no, this does not mean they have coronavirus. Like, can you explain to people why they don't need to be afraid of seeing somebody with a mask?
It's just a very normal part of the way they, you know, they're every day. In China, it's not uncommon to see it because there was a lot of smog back then, so people just wear it for their own health. So they do that too here. We got a lot of international students.
Or if they have a flu, to protect somebody from catching a cold.
Exactly, and it's all just preventative. It's mostly me speaking to them like now because we have this story going on. It's mostly because they want to not, you know, catch anything themselves. It's not that they have it, and it's just something that they've always had to keep themselves safe. It's not something that's new. It's just we're seeing it more, and I think it's like perpetuated by social media. And you know, we have to be responsible, I guess, in media for the photos we put up. Like if we're going to put up a photo of just a person wearing a mask in any Asian grocery store, like a TNT, let's say, like that would make it seem like, you know, don't go to TNT because there's coronavirus there. Which is
not true.
No, and it's so misinformed. And this person who's wearing a mask who just happens to be in that photo, like, what are you saying about that person?
Kristen, you've argued that the fear, that spreading the fear is almost worse than the virus.
Sadly, it can be, and I think the challenge for us right now is that there's so much of it is based on fear, and because people are looking for a scapegoat, the natural scapegoat is right now the Chinese population. The rates of transmission are so low to almost none, and yet this fear is playing out in big ways and very harmful, especially for the kids in the school. And we have heard now of anecdotally of people feeling like they're being denied apartments if they go to rent because landlords see see their Chinese name and they don't want to necessarily meet with them face to face. We've talked about employees who are now saying that their employers are starting to ask them to not come into work in case they may have the coronavirus, even though they've never been outside of Canada and they were born Canadian. So this is continuing to rise, but I also think that Canadians are fair-minded. Given the right information, they'll make the right decisions.
You were a kid during SARS. I think you wrote you tried to be invisible. Are things better or worse? I know you can't make a big judgment back when you were in grade 3.
I think it's better because I'm older now and I can reflect back on that and see how kind of sad that time was. I was in grade 3 and, people would just stop eating with me at lunch and, I decided to throw out all my lunches because they're not obviously it's not like crazy food or anything. It could just be like tofu, but it's just because it's Chinese food. And
so is that happening now?
I think I still see it at schools. And I mean, again, like what Kristen said, like there are stories of people being stilled. Yesterday I saw a tweet of, someone saying, oh, my mom just got yelled at by this person in a passing car saying that they're infected. Like that random everyday stuff happens and I think it will continue to happen. I do agree that there is a positive side to having social media being so accessible, especially for me, because like my mom isn't, the best at speaking English. So during that time, I don't think that she could have defended herself and she didn't want to defend herself, like me talking to her. I think having that human factor in social media really can try to sway like people in that direction because you can always share that kind of empathy. Yeah.
Thanks to you both. Thanks so much to both of you for talking to us today.